Is it possible a single medicine is effective for weight loss and diabetes? How could it do this magic? Imagine the possibilities. Would you still want to take it if it made you age faster, wrinkling and sagging your skin as a side effect? Is this side effect even true? As with all things, there are always two sides to every great story. Get ready to be amazed by the incredible magic of Ozempic. This wonder medication has taken the weight loss world by storm, and it's not just a magic pill. In this video, we'll delve into the fascinating process that makes Ozempic so effective at helping you shed those extra pounds, and that's not all. We'll also uncover some surprising side effects you need to know, like the scary Ozempic face, and how soon you can expect to see results. Plus, we'll dive into Sharon Osbourne's experience with Ozempic, including how it impacted her weight and appearance. What is Ozempic? Ozempic, also known as semaglutide, is a medication approved by the FDA in 2017 for adults with type 2 diabetes. It is a once-weekly injection that helps lower blood sugar levels by promoting increased insulin production in the pancreas. Additionally, Ozempic has gained approval for weight loss treatment. It offers dual benefits by aiding in blood sugar control and potentially supporting weight management efforts. And it also offers one scary possible side effect that is showing up on tons of Hollywood faces: how Ozempic affects the body. Ozempic, being a GLP-1 receptor agonist, has several effects on the body that contribute to its effectiveness in promoting weight loss. Let's explore these effects in detail and see how they impact the body. Number 1. GLP-1 receptor activation and appetite regulation. When Ozempic is taken, it interacts with GLP-1 receptors in the brain. This interaction triggers a cascade of events that influence appetite and satiety regulation. Firstly, Ozempic stimulates the release of serotonin, dopamine, and norepinephrine, which are neurotransmitters involved in appetite control. Serotonin activation leads to a decrease in appetite and an increase in feelings of fullness. It achieves this by affecting the hypothalamus, which is responsible for regulating hunger and satiety. The increased serotonin reduces the activity of hunger-inducing neurons, while promoting the activity of satiety-promoting neurons. Additionally, Ozempic enhances the release of dopamine and norepinephrine. Dopamine is associated with the reward system and feelings of pleasure, while norepinephrine plays a role in alertness and wakefulness. These neurotransmitters provide a sense of reward and satisfaction after eating, which can help reduce cravings and emotional eating behaviors. Number 2. Slowing gastric emptying and prolonging satiety. Ozempic works by slowing down the movement of food from the stomach to the small intestine, a process called gastric emptying. This effect is achieved through the activation of GLP-1 receptors present in the stomach. When Ozempic binds to these GLP-1 receptors, it triggers a series of events that inhibit the normal contractions of the muscles in the stomach responsible for pushing food forward. This inhibition slows down the movement of food, causing it to stay in the stomach for a longer period of time. The prolonged presence of food in the stomach creates a feeling of fullness and reduces the urge to eat frequently. This extended sense of satiety helps individuals manage their calorie intake, leading to weight loss over time. Number 3. Regulation of ghrelin hormone. Ozempic, through its interaction with GLP-1 receptors in the stomach, plays a crucial role in regulating the ghrelin hormone, often referred to as the hunger hormone. Ghrelin is primarily secreted by the stomach and plays a significant role in signaling hunger to the brain. When the stomach is empty, ghrelin secretion increases, sending hunger signals to the brain and triggering the desire to eat. However, Ozempic helps to regulate this process by reducing the release of ghrelin into the bloodstream. By activating GLP-1 receptors in the stomach, Ozempic inhibits the secretion of ghrelin, thus curbing the hunger signals sent to the brain. This reduction in ghrelin release helps to decrease the drive to eat excessively and promotes a sense of fullness and satisfaction after meals. Number 4. Improvement of insulin sensitivity. Ozempic enhances insulin sensitivity in cells throughout the body and is a significant contributing factor in the management of type 2 diabetes. Ozempic works by interacting with GLP-1 receptors on pancreatic beta cells, which play a role in insulin secretion. When Ozempic binds to GLP-1 receptors on pancreatic beta cells, it increases the release of insulin in response to elevated blood sugar levels. This increase in insulin levels helps to reduce the amount of glucose in the bloodstream by allowing it to enter cells and be utilized for energy. Furthermore, Ozempic also reduces the release of glucagon, a hormone that raises blood sugar levels. The combined effect of increased insulin secretion and reduced glucagon release improves the overall sensitivity of cells to insulin. By enhancing insulin sensitivity, cells throughout the body can better uptake glucose from the bloodstream, resulting in improved blood sugar control and reduced insulin resistance. The improved insulin sensitivity triggers the cells to maximize sugar uptake from the bloodstream and use it for energy. Number 5. Enhanced fat metabolism. Ozempic plays a role in promoting enhanced fat metabolism by activating a process called lipolysis, which involves the breakdown of stored fat. This mechanism is integral to weight loss efforts and is facilitated by the interaction of Ozempic with GLP-1 receptors on fat cells. When Ozempic binds to GLP-1 receptors on fat cells, it initiates intracellular signaling pathways that stimulate the breakdown of stored fat, releasing fatty acids. These fatty acids are then transported through the bloodstream to various tissues in the body. Once delivered to the tissues, these fatty acids undergo oxidation, a process where they are metabolized and converted into energy. By utilizing stored fat as a source of fuel, Ozempic aids in weight loss efforts. Through the activation of lipolysis and increased fatty acid release, Ozempic promotes the utilization of stored fat reserves, ultimately leading to weight loss. This process helps individuals achieve their weight management goals by targeting excess fat and using it as an energy source. It is important to note that while Ozempic enhances fat metabolism, it is most effective when combined with a healthy lifestyle, including regular physical activity and a balanced diet. Together, these factors contribute to overall weight loss and improved metabolic health. Real-life example: Sharon Osbourne. A well-known example of Ozempic's impact is Sharon Osbourne, who has publicly shared her weight loss journey. Sharon started taking Ozempic in December and experienced significant weight loss. I started on Ozempic last December and I've been off it for a while now, but my warning is don't give it to teenagers. It's just too easy, she said. You can lose so much weight, and it's easy to become addicted to that. I couldn't stop losing weight, and now I've lost 42 pounds. And I can't afford to lose any more. Sharon lost 42 pounds and didn't regret it. Her story brought attention to Ozempic's potential, not only for managing diabetes, but also for aiding in substantial weight loss. How long does it take to lose weight on Ozempic? When starting Ozempic, it may take a few months to reach the desired dose. This gradual increase helps manage any potential side effects. During this time, you might notice some weight loss, which varies depending on your Ozempic dose. Initially, the starting dose for type 2 diabetes is 0.25 milligrams once weekly for 4 weeks. This dose usually doesn't affect blood glucose or weight significantly. Its purpose is to help your body adapt to the medication. After this period, your dose is increased to 0.5 milligrams once a week. Clinical trials have shown that individuals taking the 0.5 milligrams dose lost approximately 8 pounds over 30 weeks. For some, this may not be sufficient for proper blood glucose control. In such cases, the dose can be increased every 4 weeks, up to a maximum of 2 milligrams once weekly. Generally, higher Ozempic doses lead to more weight loss and improved blood glucose control. In a 40-week study, those receiving the 1 milligrams dose lost an average of 13 pounds, while those receiving the 2 milligrams dose lost an average of 15 pounds. Potential side effects. When it comes to any medication, it's critical to understand its potential side effects. Although Ozempic is typically well tolerated, it's essential to be aware of the possible adverse reactions. The most commonly reported side effects of Ozempic include nausea, vomiting, and diarrhea. According to clinical studies, these side effects occur in approximately 5 to 10% of individuals taking medication and are usually mild and temporary. In most cases, these symptoms subside as the body adjusts to the medication. If these side effects persist or worsen, it is advised to consult a healthcare professional. While less common, certain individuals may experience other side effects, such as abdominal pain, decreased appetite, constipation, indigestion, or headache. These side effects occur in less than 5% of individuals taking the medication, and in some cases may require medical attention if they persist or worsen. If any of these symptoms occur, it is advised to inform healthcare professionals promptly. Although rare, some individuals may experience more severe side effects while taking Ozempic. These may include acute pancreatitis, gallbladder disease, or diabetic retinopathy. And one of the more alarming side effects that have emerged with the use of Ozempic is a phenomenon known as Ozempic face. This term refers to the facial changes some people experience as they lose weight rapidly. Here's what happens. Skin sagging. Rapid weight loss can lead to a reduction in facial fat, which may result in loose or sagging skin. This can make the face appear older or more gaunt. Loss of volume. The loss of fat volume in the face can cause a sunken appearance, especially around the cheeks and eyes. This is more noticeable in individuals who lose a significant amount of weight quickly. It's essential to be aware of this potential side effect and to discuss any concerns with a healthcare provider who may offer guidance on how to manage or mitigate these changes. It's essential to seek immediate medical attention if any symptoms of these conditions occur, such as severe abdominal pain, vision changes, or yellowing of the skin or eyes. Major side effects from another over-the-counter drug can be even more mysterious than the ones from Ozempic. Many people know that ibuprofen can harm the stomach, but there are other lesser-known side effects that can wreak havoc on your health. Discover these mysterious side effects, including stomach issues, in the upcoming video 5 Dangers of Ibuprofen on NATURALdocTV. Click on the video you see to the right to watch now. Like and subscribe to NATURALdocTV for more health and wellness tips, including natural and homeopathic treatments. Also, feel free to share any questions or ideas for new videos in the comments below. And we'll see you next time on NATURALdocTV.